week from November, and whether you're doing this throughout your workplace or at home with a loved one on federal assistance, open enrollment time for healthcare is here.
Yeah, we're doing it
we're doing it right now. Yeah.
Licensed insurance agent Kelly Parton of Health Markets Insurance is available to help you through the red tape and the techno speak. So good morning to you, Kelly.
Good morning.
Let's talk about open enrollment. When is it, and is this a pretty complicated situation for folks?
It can be for some people. Open enrollment starts November 1st and it runs through January 15th. So this is the time for people who have individual plans to find a new plan, change a plan, and run at it.
So these are for folks who get insurance through like the government, through the Affordable Health Care Act,
yes.
Correct?
This is individual plans, and also there's a little wrinkle that was added this year for the better. People that are on group plans, where employers are not paying for spouses and children, can now go get a subsidized plan for just them. So there's some good things that happen this fall.
Okay.
And you know, a lot of folks, they are saying so much has increased over time. Even my car insurance, right? I just saw an increase there. Are we seeing an increase when it comes to healthcare coverage as well?
Yeah, minimum of 5% usually each year. I mean, like everything else, like you said, it increases. Home prices, food, it's going to increase. Yes.
So let's talk about what you do with people, you know, how you help them through this process. Really, they just give you a call, schedule an appointment, and you go through all of the options.
We look at everything, and I ask more questions than they thought I would. How many doctors do you have? And I keep going, who else do you see? And they keep going.
Yeah.
So we want to make sure everybody's in network, want to make sure if you have meds, they're in formulary, because one medication can make a difference.
Yeah, so when people are looking to pick the correct coverage, what are some of the things that they should keep in mind? Or maybe, Kelly, some of the things that you come across that folks aren't thinking about?
It is network, especially in Toledo. It's, can I get Cleveland Clinic? Can I get University of Michigan? That's, you know, we want to make sure that where we're getting services are in network. If they're not going to be paid for.
Right, and then you're looking at a bill and going, I thought that I was covered, you know?
Yes, so doing it on your own, if you want to, great, more power to you. But I would say for 95% of the population, we're the resource where we look everything up for you.
You mentioned subsidies earlier for folks who maybe they have a spouse or a child who's not covered. Talk a little bit more about subsidies. What exactly is that, and what's available?
So a subsidy is a discount off your health insurance. Unlike your auto insurance or your homeowners, that's based off your activity or your record, where health insurance is not. So everybody pays the same rate as the other person who's the same age as them, male or female. So the plans are higher. So there's a subsidy or discount based off income. It'll give you a better monthly premium.
Okay.
Yeah, nice, Kelly. So what are some of the, because open enrollment is something we see every year. There are changes, even like we mentioned, we're on deadline for tomorrow, actually, to make sure that we have.
And yours is not.
I'm not done yet. So what are some of the biggest changes that we're seeing?
Mental health on a teledoc basis. A couple of carriers are offering mental health via teledoc, to where you can get regular copays to see a therapist, psychiatrist. You don't have to go into an office. Broader networks. Some carriers are offering, if we offer insurance in Columbus or Cleveland, you're in network with your plan in Toledo.
Oh, okay.
So broader networks is the biggest thing. Subsidies for families who have group through maybe a spouse, but they don't offer any payout for the family or kids. They can get their own plan on a subsidy. I've seen many people who the rules before were just killing middle-class families. So we have a lot more options this year.
Okay. And then I do want to mention quickly, Medicare open enrollment is going on right now.
Yes, it is.
So for folks who are 65 and older, they can be looking into their plans right now.
Yep. Right now, Medicare open enrollment runs through December 7th. So those people that are on Medicare Advantage or Part D, this is where they can change their plan for next year.
Okay.
Cool. Well, Kelly, thanks so much for all the
Thanks for having me again.
And your phone number, people want to give you a call, schedule that appointment.
Yep, it's right, should be on the screen.
I think we did have it up here.
There it is.
There it is. Yeah, so you could give Kelly a call and schedule that appointment, sit down, look at your options.
It's the same number my mom calls me on, so, and they're finally watching today, so hi, Mom and Dad.
He'll probably answer then, hi, Mom and Dad. All right, thanks for coming in today.
Thank you so much. Well, when Toledo's longest running 9 a.m. show continues.
Art from the Heart, cancer survivors express themselves and put their talents to the test in an upcoming show. How you can support them when Good Day continues.